everyone, I'm Ashley Gnelzi alongside Dr. Sarah Yovino, who I have had the pleasure of working with over the last year, and I've learned a lot from her. One of those things being that if you are having any sort of injection, whether it's stem cells, PRP, or Botox even, you want this woman on the other end of the needle. And Dr. Sarah, let's get right into it. I worked with athletes for a long time. How can athletes and even the weekend warriors benefit from stem cell injections?
Well, in the past, if an athlete had a major injury, it could be career-ending. And their only choice was maybe to go on and have surgery. But surgery comes with costs, and the costs are that it causes fibrosis of the joint space, it causes shortening of their tendons, it causes problems that can actually never restore their full function back to what it used to be. So that could still even be career-ending. And stem cells allows them an option to avoid surgery, and it allows the joint space to actually rejuvenate itself on its own and produce new collagen and new cartilage and a new joint space. It's reversing the clock.
Okay, here's a good question for you. A lot of times after surgery, it has to be managed with pain medications and things like that. What type of maintenance do athletes need to sort of do after their stem cell injections? Do they have to take an opioid? Do they have to do anything like that? What's the recovery like?
Well, the recovery initially is very easy. They just sit and wait for the magic to happen. It takes about 2 weeks for their own stem cells to regenerate and to produce and wake up. And then it takes about 6 weeks for the regeneration process. So it's about a 2-month off.
So this would be a great procedure for any athlete to come and do in the off season.
Absolutely, and opiates are not necessary afterwards.
Even better. Tell us how stem cells have changed your practice.
Well, in the past, patients would come in and they would have pain, chronic pain of some sort, whether it's from head to toe, wherever it may be. And we used to run to local anesthetic and steroid. And you can only inject that so many times before it starts to break down your bones, your muscles, your tendons, your this, and starts to have wear and tear. Sometimes their larger joints go bad from too many steroid injections. Stem cells and stem cells with PRP has eliminated that. It is a rejuvenation process. It's not just an anti-inflammatory that you're injecting, hoping that it's going to do something for the long term. This goes in and actually produces new cells, which we never had that before. And now it's used in multiple different ways, whether it's IV, whether it's in the joints, whether it's topically on the face, whether it's injected in the hair for hair regrowth. It has transformed our practice.
Wow, so it sounds like stem cells really are the wave of the future.
It is. They are magic.
Thank you so much, Dr. Sarah.
Thank you.